Hello, I'm Dr. Caleb Sterling. If you're over 50 and you walk regularly, I need you to listen to what I'm about to share with you. Walking is one of the best things you can do for your health. It's low impact, it's free, and you can do it almost anywhere. But here's what most people don't realize. There are 7 common mistakes that many of us make when we walk after 50 that are quietly damaging our joints, our spine, and our long-term mobility. I see this every single day in my clinic. People come in with knee pain, lower back problems, hip issues, and when I ask them about their walking routine, I can immediately spot the mistakes. The crazy thing is, most of these problems are completely preventable. The good news? Once you know what to look for, you can fix them today, and I mean today. So in the next few minutes, I'm going to walk you through all 7 of these mistakes. I'll explain exactly why they're harmful to your body, and most importantly, I'll show you exactly how to fix them. If you're serious about being mobile and pain-free for the next 30, 40, or even 50 more years, you need to watch every second of this video. Let's start with the first and probably the most common mistake I see. Mistake number 1. Poor posture while walking. Most people over 50 don't think about their posture when they walk. They're just kind of going through the motions. But your posture while walking is absolutely critical. Here's what I typically see. People are hunched over, their shoulders are rounded forward, their head is jutting out in front of their body, and their spine is in a position that it was never designed to be in for extended periods. Think about your spine like a pillar. When that pillar is straight and aligned, the weight distributes evenly, and everything can handle the load. But when you hunch, when you round your shoulders, that alignment goes out the window. Now, all of that weight is being concentrated on specific parts of your spine, your discs, and your joints. Over weeks and months, this creates problems. You develop pain, you develop weakness, and you create long-term structural issues. I had a patient, Margaret, who came to me with chronic lower back pain. She was walking 4 miles a day, which is fantastic, but her posture was terrible. We fixed her posture, and within 3 weeks, her pain was cut in half. Within 6 weeks, it was almost completely gone. That's the power of proper posture. Here's what correct posture looks like. Your shoulders should be back and relaxed, not scrunched up to your ears. Your chest should be slightly proud, like you're confident. Your head should be stacked directly on top of your spine, not jutting forward. And your core should be gently engaged, but not in a way that's tense. You should feel strong and upright. Your eyes should be looking forward, not down at the ground, about 10 to 20 feet ahead of you. This keeps your neck in a neutral position. Practice this right now. Stand up, roll your shoulders back, pull your chest forward just slightly, stack your head on top of your spine. Now engage your core just a little bit. Feel that? That's what you should feel like when you're walking. And here's the kicker. When you do this, your walk becomes more efficient. You'll actually walk faster without trying harder. Mistake number 2, landing on your heel first with a stiff leg. This one is so common and it's so damaging. I see people walking and their entire leg is stiff as a board, and they're pounding their heel into the ground with each step. Heel strike with a rigid leg creates what we call an impact shock. Every single time your heel hits the ground, that shock reverberates up through your leg, through your knee, through your hip, through your spine. It's like you're hitting your joints thousands and thousands of times. Here's the biomechanics of what's happening. When you land on your heel with a stiff leg, your knee is essentially locked straight. Your body then has to decelerate all of that forward momentum with rigid joints instead of allowing your muscles to absorb that impact. The stress concentrates on your joints, not your muscles. And over time, this causes wear and tear. I had another patient, Richard, who was experiencing significant knee pain. We analyzed his gait, and sure enough, he was a heel striker with a completely rigid leg. We changed his walking pattern, and his knee pain disappeared within weeks. The correct way to walk is to land on your midfoot, not your heel. Your foot should make contact with the ground around the middle of your foot, maybe slightly toward the outside. When you do this, your leg should have a slight bend in the knee. This bent knee acts as a shock absorber. Your muscles, particularly your calf muscles and your hamstrings, are designed to absorb impact. That's their job. Let them do it. As you push off from the ground, you should roll through the outside of your foot toward your big toe, and you propel yourself forward. This creates a smooth, rolling motion. Your gait becomes efficient, your joints are protected, and you're using your muscles the way they're designed to be used. Mistake number 3. Your stride length is too long. A lot of people, especially men, think that a longer stride means they're walking faster or more efficiently, so they stretch their legs out in front of them with each step. This is actually one of the worst things you can do. When your stride is too long, your leg is extended out in front of your body before your foot hits the ground. This creates what we call a braking force. You're essentially using your leg muscles to slow yourself down with every step. Not only is this inefficient, it puts tremendous stress on your hip flexors, your hamstrings, and your knees. The correct stride length is actually much shorter than most people think. Your foot should land directly underneath your hips, not in front of your body. When you think about it, this actually makes sense biomechanically. This is the most efficient position for propulsion. You can increase your speed by increasing your cadence, your step rate, not by extending your stride. Here's a quick way to check your stride. When you're walking, your foot should land roughly underneath your hip, or maybe just slightly in front of your hip. If your foot is landing a foot or more in front of your hips, your stride is too long. Shorten it up. And here's the amazing thing. When you shorten your stride, you'll probably feel like you're walking slower, but you'll actually be able to walk longer distances without pain or fatigue. Mistake number 4. Your arms aren't working with your body. Most people don't think about their arms when they walk, but your arms are absolutely critical for balance, for efficiency, and for engaging your entire body in the walking motion. If you're walking with stiff arms, or if your arms aren't swinging at all, you're missing out on the benefits of an efficient walking pattern. Your arms should swing naturally back and forth in opposition to your legs. When your right leg comes forward, your left arm comes forward. When your left leg comes forward, your right arm comes forward. This natural opposition is called contralateral movement, and it's essential for balance and for engaging your core. Additionally, when you swing your arms, you're engaging more muscles in your body. This means your entire body is working together. Your heart has to work a little bit harder, which is good for cardiovascular health. You burn a few more calories, and you distribute the work across more muscles, which reduces the load on any single joint. Proper arm swing looks like this. Your arms should bend at the elbow at about 90 degrees. They should swing forward and back, not across your body. The motion should come from your shoulder, not your elbow. Your hands should be relaxed, not clenched in fists, and your swing should be smooth and natural. If you're having trouble with this, imagine holding a glass of water in each hand. You don't want to spill the water, so you're not jerking your arms around. You're moving them smoothly and deliberately. That's the right amount of arm swing. Mistake number 5. You're not paying attention to your breathing. A lot of people don't think about breathing when they walk, but this is actually really important, especially as we get older. Proper breathing while walking ensures that your muscles are getting enough oxygen, it supports your core stability, and it can actually reduce pain. Many people, when they start walking faster or walking uphill, they hold their breath. This is a natural tendency, but it's not helpful. When you hold your breath, your muscles aren't getting the oxygen they need. Your core isn't stabilized properly, and you can actually increase pain and discomfort. The correct way to breathe while walking is to breathe in through your nose and out through your mouth. You should breathe rhythmically. A good rhythm is to breathe in for 3 steps and out for 3 steps. If you're walking faster, you might breathe in for 2 steps and out for 2 steps. The point is that you should be breathing steadily and consistently. I recommend using what we call diaphragmatic breathing. Breathe down into your belly, not up into your chest. When you breathe into your belly, your diaphragm contracts and moves down. This naturally engages your core muscles. Your core becomes more stable, your spine is better supported, and you have better posture and less pain. Mistake number 6. Your footwear isn't appropriate for your feet. This is something that a lot of people overlook. Your shoes are literally the interface between your feet and the ground. If your shoes aren't right for your feet and your gait, everything else suffers. There are a few things to consider. First, are your shoes appropriate for walking? Shoes designed for other activities like basketball shoes or running shoes might not be ideal for walking. A good walking shoe should have good arch support, a cushioned heel, and a flexible sole that allows your foot to bend naturally. The heel should be lower than a running shoe, typically around 1 to 1.5 inches. Second, do your shoes fit your feet correctly? A lot of people have never had their feet properly assessed. Some people overpronate, meaning their feet roll inward. Some people supinate, meaning their feet roll outward. And some people have neutral pronation. Depending on your foot type, you need shoes that support your specific gait pattern. Many specialty running and walking stores can analyze your gait for free. Third, are your shoes worn out? If you've been wearing the same walking shoes for 3 years, the support is gone. Shoes typically last about 300 to 500 miles. If you're walking regularly, you probably need new shoes every year or two. And fourth, are you wearing socks that work with your shoes? Cotton socks absorb moisture and can cause blisters and friction. Moisture-wicking socks designed for walking are much better. They keep your feet dry, they reduce friction, and they're more comfortable. Getting the right shoes might sound like a small thing, but I've seen it completely eliminate foot pain, knee pain, and lower back pain. It's that important. Mistake number 7. You're not warming up or stretching. This is the last mistake, and it's incredibly common. A lot of people just walk out the door and go into their walking routine, or they finish their walk and they don't do anything to cool down or stretch. This is a missed opportunity, and it can actually lead to problems. Before you walk, you should warm up. A warm-up doesn't have to be complicated. Just spend 3 to 5 minutes doing some light movement. Swing your arms, do some leg swings, do some gentle walking. Get your heart rate up just a little bit. Get your muscles warm. This increases blood flow, it prepares your joints and muscles for the work ahead, and it actually reduces your risk of injury. After you walk, you should spend 3 to 5 minutes cooling down and stretching. This helps your muscles recover. It reduces soreness the next day, and it improves your flexibility over time. Here are the stretches I recommend after walking. First, do a calf stretch. Put your hands on a wall, step one leg back, and lean into it. Hold for 30 seconds. Do both sides. Next, do a hamstring stretch. Put one foot up on a step or a bench and lean forward. Hold for 30 seconds on each side. Then, do a quadricep stretch. Stand on one leg, pull your foot up toward your buttocks, and hold it. 30 seconds each side. After that, do a hip flexor stretch. Step one leg back into a lunge position and gently press your hips forward. Hold for 30 seconds on each side. And finally, do a gentle spinal twist. Sit down, cross one leg over the other, and gently twist toward your bent knee. Hold for 30 seconds on each side. These stretches only take a few minutes, but they're going to make a huge difference in how you feel and how your body responds to walking. Putting it all together. So let's bring all of this together. You now understand 7 critical mistakes that many people over 50 are making when they walk. You know how each mistake is affecting your body, and you know exactly how to fix each one. Start with posture. Stand up straight, roll your shoulders back, stack your head on your spine, engage your core gently. Walk with this posture every single day. Next, think about your foot strike. Land on your midfoot, not your heel. Keep a slight bend in your knee. Let your muscles absorb the impact. Shorten your stride. Land your foot underneath your hips, not out in front of your body. Let your arms swing naturally. Swing from your shoulder. Keep them relaxed. Let them work in opposition to your legs. Pay attention to your breathing. Breathe in for 3 steps, out for 3 steps. Breathe into your belly. Make sure you have the right shoes for your feet. Get them assessed if you need to. Replace them when they wear out. Wear the right socks. And don't skip the warm-up and cool down. Do a 3 to 5 minute warm-up before. Do stretching after. Now here's what I want you to do. Pick one of these 7 mistakes that you know you're making. Maybe it's your posture. Maybe it's your stride length. Maybe it's your shoes. Pick one. Focus on fixing that one mistake for the next week. Once you've got that one fixed, move on to the next mistake. By working through these one by one, within a month, your entire walking pattern is going to be transformed. And here's what you're going to experience. You're going to have less pain. You're going to be able to walk longer distances. You're going to have more energy. You're going to move more efficiently. And you're going to be protecting your joints for decades to come.